Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. As always, we're joined by Dr. Robert Popovian, tuning in from Washington, D.C. He's a pharmacist, he's an economist, and he's the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my good friend, Connor Mertens from Seattle, Washington, my co-host, and our patient advocate and community outreach manager.
And today, Robert, we're going to be joined by our friend and fellow colleague, JP Summers, who, like me, is a patient advocate and community outreach manager at the Global Healthy Living Foundation. She was recently in Wisconsin to support a bipartisan legislation aimed at ensuring copay assistance programs benefit patients instead of insurance companies. But we'll get into that in a few minutes here.
We're so glad to have her join us. She will tell us more about her trip to Wisconsin and, more importantly, provide us with a patient perspective of why such regulations or policies are toxic to the patients. So today, Connor, I want to ask you a number like we always start our podcast with. And the number I have in mind is number 16. And don't tell me it's your favorite football player, Joe Montana's number.
No, even better. It's my number. I was 16 in high school, middle school, college. So I think it's time to retire that number. So if your answer is that 16 is the number we should be retiring, then you're probably right.
Well, the 16 number should be retired considering your prowess in the football field. But I was more thinking about that there are 16 states that have passed legislation protecting patient assistance programs to this day. And in fact, New York State is the latest one that passed. And why JP is here today with us is because she was out in Wisconsin trying to advocate for passage of that similar law in the state of Wisconsin.
And hopefully Wisconsin will be number 17 on that list. So, Robert, today we're going to be talking about patient assistance programs and out-of-pocket costs and copay assistance. Is that kind of what I'm getting?
Yes, definitely. We're going to delve into that and specifically discuss how and why are patients being taken advantage of by insurance companies and pharmacy benefit management companies.
Well, let's dive in. Robert, let's just start with the basic question. What are patient assistance programs?
So patient assistance programs came about probably about 2 decades ago, and they were primarily meant to help patients who were uninsured, who couldn't afford their drugs, and they needed some assistance from the biopharmaceutical industry to pay for those medicines. They've evolved into a much more complex and Byzantine system because majority of the patients now that get care or patient assistance from the biopharmaceutical industry are actually fully insured and fully employed individuals. It just happens that their benefit design and insurance model creates an environment that they can't afford their medicines, and hence they have to reach out to either biopharmaceutical industry or foundations for additional support.
So where are we at right now with out-of-pocket costs? Are they increasing? Are they kind of staying the same? What are we seeing for these out-of-pocket costs for patients right now?
So we've talked about this actually, Connor, in the past in one of our podcasts. And, on average, the out-of-pocket cost for patients, the average patient has been going down in the United States for pharmaceuticals. They spend less in out-of-pocket costs for drugs today than, let's say, 10 years ago or 20 years ago. But that's an average. And you got to be careful with averages because what happens is that there is a group of patients who are clearly being harmed by the current policies. And the reason, by the way, that the averages have been going down is primarily because, 90+% of prescriptions in the United States are generics, and generics are super affordable for patients. And there are other issues with the generic market that we've delved into in the past. But currently, the average out-of-pocket cost for an individual patient does go down, but that's not the case for certain patients, which are being harmed.
Yeah, and Robert, you mentioned those specific patients that are feeling a little bit more pain in the pocketbook, but can you tell us a little bit more why these groups of patients are struggling more than, what you said, which is the average is going down?
So there are two reasons. Number one, these patients require probably brand name medicines that don't have generic equivalent products available in the marketplace. And those drugs are expensive, and they're becoming more and more expensive as we get into more rare disease, biologic type of therapies. The second reason is frankly because of benefit design changes. 10 years ago, number one way patients paid for their pharmaceuticals was through copays. Copays are flat amounts that patient walks into the pharmacy, they know exactly exactly what their copay is for their drug. They pay that copay and they walk out. Over the last 10 years, benefit design for drugs has shifted to more coinsurance, which is a percentage of the retail price of the medicine, and also deductibles, which is also based on the retail price of the medicine. So that's why they're feeling the pain more, this select group of patients, because they get into an environment that they require these very expensive medicines, while the benefit design has shifted and has put more pressure on them through payment of coinsurance and deductible, which is based on these inflated retail prices, which, by the way, the insurers and the PBMs don't pay. They negotiate significant rebates and discounts and fees from these pharmaceutical companies. And unfortunately, they don't share any of that with the patients.
Well, we're throwing around a lot of big words in there, but two things that I think we should probably hash out a little more are, what do we mean when we're talking about accumulators and maximizers?
So these are programs that came about maybe 4 or 5 years ago. And what they do, in a very brief way of explaining them, is that they require that any kind of patient assistance program that comes from the biopharmaceutical industry could not be applied to the patient's deductible or maximum requirements for their out-of-pocket costs. So in other words, the money that the pharmaceutical industry provides to the patient to help support their out-of-pocket costs is collected by the PBM. And then in addition, then the PBM goes back to the patient and collects even more money to meet the deductible of that medicine or the coinsurance of that medicine. And it's become a point that they're double dipping. They're stealing the money from the patients that the pharmaceutical industry has sort of provided them to help afford their medicines. And at the same time, they force the patient to again pay for their medicines, and they have to pay for it until they meet their deductible or their out-of-pocket cost maximum.
Yeah, I mean, it really sounds like patients are being taken advantage of here.
Exactly. And that's the bottom line, is that these insurers and the PBMs are double dipping and not only extorting money from the patients that was meant for the patients, that was designed to help patients afford their out-of-pocket costs, but then they're going back to that same patient and it's still collecting more money from them directly.
Well, Robert, we always like to get into the policy and the legislation and what's being done about these issues that we raise on these podcasts. And at the top of the show, we discussed that lots of states were taking action. So what are states doing and how are these laws coming about?
So these laws are primarily being promoted through patient advocates and patient advocacy groups and provider groups that are concerned about this extortion by PBMs and insurers of the patients. And what these laws do is that they're very clear. They mandate that any kind of out-of-pocket costs provided by the patient to meet their deductible or their coinsurance or their copay or their out-of-pocket maximum has to count towards their deductible, period. So any kind of support from any entity that the patient gets has to count towards the patient's deductible. And as we discussed, 16 states have passed, and we're going to have JP come on a little bit later and talk about what they're trying to do in Wisconsin, which is the same thing.
Well, we know, and we ourselves are one of those patient advocacy groups that push for these kinds of reforms. But I got to imagine that the pushback is probably coming from where? Are we talking from insurers and PBMs?
Clearly, I mean, it's coming from insurers and PBMs because this is a profit model for them. They're double dipping, and this is a revenue source that they capture as profit. So they have criticized these laws that have passed in these states that they will force an increase in premiums, the insurance premiums in those states. Fortunately, as always, in our organization, in Global Healthy Living Foundation, we're very forward thinking. So we've created a tool which is available to anyone. It's on our website on GHLF.org. You can Google it and find it. That anyone can go, policymakers, patients, patient advocates, providers, insurers, even PBMs, they can go and take a look at premiums in the states that have passed this legislation versus premiums in the states that have not passed the legislation. What they'll see is that there's absolutely no difference in premiums between the states that have passed and the states that have not passed. We've done statistical analysis, and to date, of all the 16 states that have passed this legislation, their premiums have not gone up nor gone down, either post passage of this legislation statistically, or is there any differences between the states that have passed it and the states that have not passed it? So in essence, Connor, what the insurers and the PBMs are criticizing these laws about, which is, well, if you pass them, they're going to increase the premiums, the health insurance premiums, is absolutely not true. The data does not support their rhetoric. And as always, we have the data. The data was captured through governmental agency provided information through the Johnson & Johnson Foundation, actually, that provides a website that has all of the premiums. And we were able to analyze this information and put it on the website, which is available again to anyone who's interested. And they can go look at every single state that has passed their insurance premiums and compare it to the states that have not passed it. And they will see exactly what we are discussing right now. There are absolutely no differences, and there are absolutely no statistical differences between those.
And don't forget, you can find the link to that tool in our show notes. Well, it's good to hear that there's some states that are passing laws to protect patients from these harmful practices. And one of those that we're hoping to add to the list is Wisconsin. We have a local celebrity here, JP. JP Summers is one of our colleagues, and she recently spent some time representing GHLF, but more importantly, patients and the patient community with policymakers in Wisconsin who are interested in helping out patients and institute patient protection laws to ensure that patient assistance programs are not going to be stolen by insurers and PBMs like we discussed. But thank you so much for joining us, JP.
Yes. It's great to be here.
Yeah. So you yourself are a patient living with some conditions and also a patient advocate. What's it like to have both those roles?
Well, it's a very important role, both of them actually, because, when you go through the process of seeking help, getting medical assistance, and then finding a treatment, and then how do you go on from that point? It's the whole process. But at the same time, it helped me to become the advocate I am today, because had I not gone through that whole experience, then I wouldn't know what to look for, what to be actively involved in when it came to pushing issues.
So, JP, first of all, thank you for coming on. From your perspective, how would you think the law will help a patient, such as yourself? I'm sure you've experienced this, getting patient assistance from the biopharmaceutical industry.
Yes, Robert. And the number one thing is it would not put any unnecessary financial situation onto the patient. I have been there. I have shown up to pick up my prescription, and all of a sudden the price that I was paying before tripled. And to me, when you're living with several chronic illnesses, to have your medication suddenly change is very unexpected. And it puts you in a financial situation where you have to make decisions, and very tough ones at that.
So how was it, JP? How was advocating in Wisconsin? What was the mood? Are folks excited? Are lawmakers and stakeholders, are they listening? Is there hope for Wisconsin being another one of those states to pass along these protections?
I feel that there was a lot of positive things being said. There were several patients besides myself there to advocate, to share their personal stories. But what really caught my attention was the press. They were very involved. They were asking questions. And that tells me that they're invested in what we're looking to do in Wisconsin.
So one benefit is that Connor and JP, looking at the map right now, this is truly a bipartisan issue, because you're seeing states like New York pass it, which are truly blue states. And then you see states like Louisiana and Oklahoma pass it, which are truly red states. So I believe that there's an opportunity in every state to pass this patient protection law. And we're so happy, JP, that you were there advocating for patients, representing GHLF. And also, one quick question. Did the issue of the tool come up that we've developed at GHLF in any of your meetings there?
Well, I mentioned it in my press conference when I was sharing my personal story. I did mention that, we have this tool that is on our website. So it was mentioned during that time. But anytime I'm speaking with someone, I do tell them to check our website, because we have great resources, but especially this one in particular.
JP, thank you so much for going to Wisconsin, making your voice heard and standing up for patients, and B, for coming on with us. We'd love to have you, and you're welcome back anytime.
Great. Yes, I enjoyed it, and I'm sure there will be more to come. Some very exciting things happening, and also in other states that I will be participating in. So yes, thank you for having me.
So just to echo what Connor said, JP, you're always welcome to come on. We love having patients' perspectives heard on this podcast. And please, when you go, and yourself too, if you have any thoughts about policy issues, economic issues that are impacting patients, if you have questions or you hear things, let us know. I mean, we would love to talk about those issues on our podcast here.
Definitely. And like I said, there is some things that are coming up that I'll be participating in. And I'm sure there's going to be a lot of information that I can share with the both of you.
Looking forward to it, JP. We'll see you soon. Nothing changing this time, Robert. I'm going to make sure you get the last word, but I think that it's great for us to have JP on to get the patient perspective of how these policies can really negatively impact patients. And it's good to hear that things are happening on the state level. There can always be more, but we need to be making laws that are protecting patients, increasing visibility, and at the end of the day, making sure that patients are getting the most benefits from these programs that are designed to benefit them and not the insurers and PBMs.
That's right, Connor. I mean, at the end of the day, we are here at GHLF trying to advocate for patients, but we're also here on behalf of GHLF to develop tools and opportunities to demonstrate how patients are being taken advantage of, but more importantly, how we can protect patients from being taken advantage of by insurers and by the pharmacy benefit managers specifically. And this is one area that we've spent a lot of time and resources, and we are hoping that people, individuals, policymakers, as I said, providers, patients, patient advocacy groups, go to our website, take a look at it, get educated, because this is important. We have passed it in 16 states, but there's 34 states left that need to pass this law. And in addition, state laws are only go so far, and we need to introduce legislation federally to protect all the ERISA plan type patients that are not granted the protections from a state level and have to have federal legislation passed for them.
As always, thanks for breaking that down for us, Robert. I think there's some very valuable information in there for our listeners. And thanks to JP for joining us today and bringing your patient and advocate perspective to such an important conversation for patients. Don't forget to subscribe to our podcasts on Apple, Spotify, or wherever you might be listening, so you'll never miss an episode. And now you can actually find our podcasts on YouTube. We're literally everywhere. And if you have a second, help spread the word by rating our podcast, writing a positive review, and sharing with your friends and family. It'll help more people like you find us.
You can also send us an email or audio clip to healthcarematters@ghlf.org. And we want to hear from you. We want to hear your ideas. We want to hear your questions. And as I mentioned to JP, especially from patients, we want to hear what your questions are and how we may help you at GHLF to be better patient advocates.
And before you go, make sure you take a listen to some of our other great podcasts on the GHLF Podcast Network. You can find all of GHLF's podcasts at ghlf.org/listen. He's Dr. Robert Popovian.
And he's Connor Mertens.
And I'm JP Summers.
We'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.